Thank you, everybody. Well, I'm going to introduce myself and Angelina, and then we will continue with the webinar, and people will join us as they can. I'd like to welcome you to the SAPICS VillageReach webinar this afternoon. My name is Claire Fincham. I'm the SAPICS Marketing Manager. We are privileged to have VillageReach as a corporate member of SAPICS, and they are so supportive of all of our initiatives that we have. SAPICS is the Association for Supply Chain Management, and we educate, empower, and elevate individuals and organizations through our memberships, our events such as this, our education program, and our annual conference. So it's great to have you all with us this afternoon, and I'm going to hand over to Angelina Cumba. She's the outsourcing logistics expert and team lead at VillageReach. She's based in Maputo, and so she has the pleasure of looking at the Indian Ocean at the moment. So over to you, Angelina. Thank you very much, and to her and all the speakers for their time this afternoon for the SAPICS community.
Thank you, Claire, and thank you, everybody. Good afternoon, good morning, good afternoon, good evening, everyone, depend on where you are joining us from. It's a real honor for me to serve here as a facilitator for today's webinar. My name is Angelina Cumba, as Claire said, and I'm supply chain and operation management professional with over 15 years of experience driving logistics innovation across Africa, Asia. I hold a master supply chain management, and I'm a certified member of the European Logistics Association, and I also currently pursue my second master in public health procurement and supply chain management. So at VillageReach, I lead the Outsourced Transport Resource Center program that works closely with the government, donor, private sector to design sustainable transport solutions so that essential health products can reach every community, no matter where you are. So today, before we meet our speaker, let me briefly share the objective of today's session. We are here to explore the state of outsourced transport, warehouse, and broader health supply chain from Kenya, Ethiopia, Mozambique, and Zambia. And these discussions draw on from the insight from the VillageReach Outsourced Transport Warehouse Perception Survey, as well as lesson learned from the US Top Order. So our panelists representing governments, implementing partner, and private sector will share their perspective on outsourced public health supply chain. They will highlight challenges, lessons learned, and opportunities for collaboration. But most important, we are going to focus on the practical steps needed, to build more resilient health supply chain for the future. So to guide us through this important conversation, we are joined by our outstanding group of leaders from across region. It is my pleasure for me to introduce them, beginning with Zambia. Mr. Kasonde from Senior Government Leader Shaping National Pharmaceutical Service. Mr. Maxwell Kasonde is a pharmaceutical public health specialist with over 20 years of leadership in Zambia health sector. As a director of pharmaceutical service at the Ministry of Health, he has championed major reforms in medicine policy, supply chain strategy, access to essential medicine. Is also currently driving the vision to a fully digitalized and integrated pharmaceutical supply chain. Please help me to welcome Mr. Kasonde. And unfortunately, he will be with us for the next 30 minutes, so ensure he has the opportunity to share his insight before he jumps out to a very important meeting. And moving on to Kenya, a leader in the forefront of public health supply chain reform, Ms. Eliud Murithi, I hope I pronounced it correctly, is a chartered procurement and supply chain professional with an MSc International Public Health and an MBA, decade leadership experience across United Nations, private sector, then government, and currently he is the Director of Commercial Service at KEMSA. He has worked in multiple African countries, driving reforms and championing strategic partnership. Please welcome me to join Ms. Eliud Murithi. Now from Kenya, we move to Ethiopia. We are now turning to Ethiopia to meet a private sector leader advancing innovative supply chain solutions. She's also one of my favorite women in supply chain, deeply passionate about this work as I am. Ms. Yodit Admas Riham, I hope I pronounced it well as well, is the Managing Director of Operating Time Health Supply Chain Solution Division with over 15 years of experience in public health supply chain management. She has also led transformative projects across Africa, leveraging digital tools, private sector strategies to strengthen public sector efficiency. And welcome Ms. Eliud to our conversation, returning to Zambia from private sector where innovation meets cross-border operations. Mr. Prince Dube is the Regional Manager for Access Solutions Africa Limited, overseeing operation across 5 African countries with 7 years in healthcare logistics, a strong background in ICT and supply chain leader. He has also driven public-private initiatives in outsourced transport, digital system, and health product distribution. Please welcome Mr. Prince. Then now, coming back home, we return to Mozambique to hear from the seasonal professional leading last mile deliver innovation. Mr. Antonio Mabuiangue is a supply chain specialist with over 15 years experience in Mozambique public health logistics. He has also led outsourced transport and last mile delivery operation under USAID and Global Fund Project Last Mile. Is currently project manager at the Project Last Mile. He's continued to drive innovation, distribution strategy, and please welcome Antonio Mabuiangue to the webinar. And before we move to our conversation, I would like to acknowledge someone very important, Dr. Lucrecia Venasio Mateus. Unfortunately, she was supposed to join us. She's the Deputy National Director of CIMA Mozambique. She was scheduled to join us today, but unable to attend due to work commitment. So Dr. Lucrecia has been dedicated and passionate leader playing a vital role in strengthening Mozambique supply chain. We deeply value her contribution and look forward to, to engage with her in future discussion. So thank you all our panelists for joining us. And we are now moving to our discussion where each panelist will have 5 minutes to share their insights on the question ahead. But before that, we start our discussion. I'd like to remind everyone, please put your mic on mute and share your questions or comments in the chat. At any time during this session, we'll be collecting them and addressing as many as we can during the Q&A segment. So, starting with Zambia, Mr. Maxwell Kasonde, this is your question, and you have 5 minutes to give your experience and your opinion about that. From experience in the Ministry of Health, what lessons has Zambia learned from the past experience with outsourcing transport, and how can this insight be applied to better mobilize the private sector to enhance public logistics in the future? Over to you, Mr. Kasonde.
Thank you very much for this opportunity to join colleagues on the call and share some experiences. Let me attempt also to look at the question in terms of past experiences with outsourcing. Allow me to start by stating that before 2018, the 3PL transport services was not used in the public health sector in Zambia, but it has been there in the private sector. So traditionally, the public sector used to focus more on owning and buying more freight to be able to distribute to all 10 provinces or 10 regions. So when we had support from Chemonics, it started supporting the central warehouse, and came up with proposals for provision of transport service and distribute commodities from central warehouse to the 7 regions, and also to conduct last mile distribution from the hubs to selected districts. So that's where really we started picking up the experiences. And what we noticed was that in the space of also the private sector, the discussion and interest in terms of response was more focused on payment terms. And the discussion had to be balanced so that we show them also our concern. But also, because of previous experience in terms of dealing with government, there was also some bit of misperception whether if we are dealing with the government agents, they are assured of the payment. And I think that's where the concern of payment terms was coming from, because of probably the past experience of delaying payments. But again, we noted that the vendors face challenges to mobilize financial resources, even after being given the contract. And the companies also lacked understanding of the difference between just a car hire services and provision of distribution of services, as evidenced by the pricing mechanism. So you could see that they have not had much experience in this area. So also noted that our business requires containerized vehicles, but most companies also failed to meet the specifications. And the demands for transport, again on our end, when we started dealing with the region, the demand for transport or utilization of the private transport using 3PL also became a challenge on our side, because we needed to be well organized. So the demand for transport from the regional hubs was also not consistent. So you find that you start experiencing a lot of idle times, which became unattractive to some vendors because of cost of mobilizing becomes much higher. So these are some of the issues that we noted. And we had to embark on having some regular meetings with the private sector, between our implementing partner and also government and also the warehouse, so that the expectations are well understood from both government as well as the private sector. So they needed also to mobilize more financial resources so that they can do, multiple distribution points. So some of the lessons learned was that we needed clear contractual agreements and obligations, because we also reviewed on the other end of the contracts that to ensure accountability and defined performance standards and reduce misunderstandings and service disruptions, we needed to be very clear with the contractual agreements. But also we thought having a one-off monitoring would do, but then we noted that we needed a very good regular oversight and of performance to ensure that the private sector meets the quality, timeliness, and safety requirements. Because absence of this monitoring and evaluation showed that outsourced transport may not be operating within the agreed TORs once they are out. So we needed to enhance the mechanisms and the monitoring. But also, like I said, we needed to strengthen the local capacity and also increase the partnership. Not so many people are interested, but later on, when they saw that the payments are regular, we had more people responding. But also the other issue is we also had to leverage on the technology in terms of utilizing tracking and data management systems to improve the coordination and also decision making. This was piloted using the 3PL in the country to ensure effective use of the resources and monitoring the transportation, how it is going. So we are hoping that the insights that we got can be used for future mobilization to create better contractual frameworks and performance-based incentives, and also tracking the systems so that you also have the real data collection to enhance oversights, and also partnership. Allow these transporters also to maybe do a partnership so that they have more capacity and be able to deliver according to the schedules that are given. And also the contingency plans from our private sector and flexibility in the operations. So those are some of the things that we noted, and we hope that we can do better as we go on. Thank you very much.
Thank you, Mr. Kasonde. I really appreciate, and that was very valuable reflection. I appreciate the way you emphasize the challenges around fleet expansion, the early support for economics, and the private sector focusing on payments. Your points on government delaying payment, pricing mechanism, and the importance of the clear contractual agreement and strong accountability measures are also very critical. And building on this, could you share what role you see the government in creating the right environment, whether through policy, financial partnership model to ensure that outsourced deliver sustainable improvement, reliable and efficient? So elaborate a little bit on what the government can do in creating the right environment.
Thank you very much. So again, it goes with the policy decisions by government, whether you still want to invest in buying vehicles for distribution, or this is something that can be outsourced. So from where we stand, we now come to a point where we all agree that we can outsource. And if you look now at the policy measures that we have in our medicine policy and health policy, it speaks to that, and some measures put in place. In the early years, it's something that you may not talk about because of mistrust between private and government, not knowing that you can actually leverage on each other's strength and create a win-win situation, or still contribute to effective service delivery. So perception, policy, I think that would help us to move in a direction, and also awareness of the policies that are available, because in some cases, we noted that the private has a lot of innovations, but then they don't know who to talk to. Even when they come, let's say, to the ministry or government agents, they don't even know which right person again to see. And then because time is flying and private and public operate on different directions, because government are more bureaucratic and private, want to make decisions within a very short turnaround time. So you find they get frustrated and then they don't come back. So I've noted that gap to ensure that when we share more information and we're more transparent, then you build that trust to make sure that you are working together. Then they have to look for information every time, and then they get frustrated, and then you stop working together.
Thank you, Mr. Kasonde. I think what you've said is very relevant and it's clear. No moving back from outsourcing. We need to leverage private sector. We need to ensure transparent and have contracts that in clearly, with the clear performance indicators and benefit both private sector and the government. So moving on from Zambia, thank you so much. I'm gonna call Kenya right now, Mr. Eliud. From Kenya perspective, how has the involvement of private sector in transport service shaped Kenya health supply chain strategy? What are the key opportunities for strengthening this partnership to ensure more efficient and sustainable health logistics? And looking ahead, what priority areas should be the government focus on further integrating the private sector? And you have 5 minutes to give us your thoughts. Is Eliud, is he here? Claire, is Eliud with us or he just dropped off? Okay, so looks like there's some technical issue with our Kenya government representative. Claire, can you please call? Claire, can you please call Mr. Eliud? He's calling me right now. I think he's having issue with his connection.
Okay.
While we are waiting for Kenya to come in, I would like to move to Ethiopia. Miss Yodit, how are you today? How can private sector companies like Freight in Time works with the Ethiopian government to enhance the overall transport strategy for health supply chain, ensuring greater efficiency and resilience? Which priority area do you see should be targeted to create a stronger partnership? 5 minutes, madam.
Thank you, Angelina, for the warm introduction as well as for the question. So for me to be able to answer and for you to be able to hear me, I have turned off my video because of the network connection in our country. So moving on to your answering your question, I have to start from historical background. I'm not going to take much time when I talk about the historical background of private sector being engaged with government. It has been a challenging journey for FIT as well as some of private organizations that work with government of Ethiopia. For the past 5 years, FIT as a private sector, as a donor-funded project implementer, as well as a 3PL 4PL partner of EPSS, has come a long way to become one of the trusted partners of EPSS and MOH to date. So this journey has taught us valuable lessons on how private sectors could work with government of Ethiopia. The first thing is, the persistent advocacy to create this mind shift of for-profit organization only going after the money, not providing valuable, not having that valuable insights or efficiencies to bring into the public sector. So saying that, I had the priority areas that we needed to work on. This is there are 5 areas that I would like to point out. The first one being structured strategic outsourcing transport functions. Previously, majority of private sector engagement had become an ad hoc procurement. When we talk about the procurement of outsourcing, it has become an ad hoc and when the need arises. I can give you an example from EPSS. When there is a need for transportation from one of the ports to one of their warehouses, or when there is a need to transport to the last mile, there had been a request, not formalized, but decentralized and ad hoc kind of transportation needs. And this needs to be structured. It has to be part of the strategic outsourcing of these transport functions. So there is a need for implementing a clear competitive outsourcing framework for transport underpinned by robust service level agreements, and also there has to be a transparent monitoring and performance-based initiatives. If you remember some of these outsourcing toolkit pilots in EPSS that VillageReach and ARC has done, there has to be, from those kind of pilot programs and our pilot programs, EPSS and MOH need to take notes from that and learn from that and bring about structured strategic outsourcing transport function. The other one is there has to be a public-private platform for supply chain governance and policy reforms. We usually see these platforms being available for other kind of activities, not engaging the private sector itself in designing, co-designing, institutionalizing, and a multi-sector supply chain governance platform. So this has to be implemented as part of it. And the other one is collaborative risk management and quality assurance. Governments usually tend to fear of the risks that come with engaging the private sector. So there has to be a collaborative risk management and quality assurance framework, especially dealing with health commodities. And the other thing is there has to be a joint capacity building and capacity building for the workforces that engage the private sector, so that the government counterpart can be able to manage the private sector. There has to be a capacity building element. But all this come to the final point of sustainable financing and resource mobilization. Our colleague earlier was saying that usually it got stuck at the end in the finance element, the finance part. So there has to be a financial element, a sustainable financing and resource mobilization. So these 5 parts could be one of the 5 parts should be prioritized for private sectors to be able to work with governments. Thank you, Angelina.
Thank you so much, Eliud. And I really like your perspective, especially highlighting the long journey it has taken for the private sector to become a trusted advisor, like a trusted partner with the government. The lesson learned around the persistence, advocacy, and the risk of fragmented ad hoc approach underscore also the value of having structured outsource strategy. So I have a question for you, building on your response. What do you see the most practical first steps that government and the private sector could take together to translate these priorities area into tangible improvement on the ground?
So I would come to the first point I made. It has to be structured. Government should be able to know which areas they can outsource, especially in which area should be outsourced. If it is transport, which part of transport that the government cannot do and the private sector can do it better in an efficient and in a most cost-effective way. So the very first step should be the government should know which area that they are weak at and which area that the private sector can work with, and what capabilities do they have to manage the private sector. So I prefer if the first step could be having a structured strategy and knowing what capabilities they have.
Thank you, Eliud. And I know I was one of the personal privileged to work with you, and I know how passionate you are and really understand, especially around collaborative risk management, quality assurance, joint SLAs and capacity building. So thank you very much, Eliud, and everyone have patience for your deeds. For also Zambia, Kasonde, please put it on the chat. And now we are moving to Kenya. Clay, do we have Kenya back online?
Yes, you do.
Yes,
So,
you,
thank you. Good day, everyone. So my name is Eliud Murithi.
Yes.
I am supposed to give a perspective on how the involvement of the private sector in transport services shape Kenya's health supply chain strategy.
Yes.
Most important.
Okay, go ahead. If you had my question, I wanted to repeat it for you. Like from the KEMSA perspective, Eliud, how has the involvement of the private sector in transport service shaped Kenya health supply chain strategy? What are the key opportunities for the strengthening this partnership to ensure more efficient and sustainable health logistics? And lastly, looking ahead, what priority areas the government must focus on for further integrate the private sector?
Oh, thank you very much. So in terms of policy level, we do have what we call Kenya Health Public-Private Collaboration Strategy of 2020. And then, of course, we do have Pharmacy and Poisons Board, good distribution practices, which are borrowed from the WHO good distribution practices that guides on how we should be able to engage in a possible partner, especially so the 3PL. So in Kenya, what we've done is that we have embraced public-private partnerships. So we do have private transporters assisting the distribution of health products and technologies. We have divided the country into 4 regions, and each and every transporter has a region that they cover, and then we have courier services engaged for small and fast deliveries. So most important is the fact that this partnership has helped in the distribution of HPTs and definitely vaccines. So vaccine is a key component, and especially so in managing issues such as cold chain in the distribution chain, route planning, because now route planning goes to the private vendor, and then of course last mile delivery, because we do last mile delivery. A little bit of some difference in our health supply chain is the fact that we have embraced the demand-driven supply chain, where we serve 47 counties based on their demands, as opposed to the push system that was there before. So a lot of route planning has to be done by our vendors, of course, working closely with our distribution department. We have a fully fledged distribution department. Initially, I must admit that most of our distribution was donor-driven, in the extent that if USAID through Chemonics are procuring, then quite often than not, that will be donor-driven, another donor, GTZ, and any other one, Danida and any other donor who is assisting the procurement. So we had so much fragmented distribution. So we agreed to integrate through the national mechanism, which is KEMSA, having in mind that KEMSA is working with the private sector. Hence, KEMSA has elastic capacity to be able to meet any distribution requirements, where the emergency distribution or normal distribution. So the other thing is that we have also come up with the Kenya Public Health Emergency Supply Chain Framework, informed by the fact that there are many stakeholders involved in the distribution. So there's a framework guiding on how logistics, especially so distribution, can be handled. Well, I mean, you can't escape mentioning about ambulances as well. So in quite a number of instances, ambulatory services are also given to third-party providers. Then the other thing that it has done is that it has enhanced coordination and cooperation between the various stakeholders. And then, of course, we are forced to come up with KPIs and SLAs, service level agreements, that are monitored frequently. In fact, this morning I had a board meeting, and we are about to kick out one of the transporters because they have failed the KPIs and SLAs. And when they fail, we are failing as well. And we are implementing universal health coverage at the moment, and efficiency, effectiveness is very important in health supply chain. What else do I need to mention? Of course, engagement is frequent. We do engage with third-party logistic providers and, of course, our stakeholders. Because what has happened is that we have also signed SLAs with the counties. Over and above a memorandum of understanding that we have with the counties, we have SLAs. And one of the SLAs speaks about, if it's hospitals, how fast are we supposed to deliver health products and technologies? If it's primary healthcare facilities, how fast are we supposed to deliver? So the SLAs around that. And then some of the key impacts on Kenya's health supply chain strategy, as I mentioned, it has brought more of faster, more efficient distribution, including cold chain integrity and last mile delivery through outsourced transport. By ensuring that when we are outsourcing you, we ensure that you have the capacity, and especially so for cold chain, and of course we monitor the integrity of those vehicles frequently. And then I also mentioned about the contracted logistics and ambulatory services to ensure rapid response in critical situations. So like when we had COVID, the turnaround time of distribution was pretty fast because, as I mentioned, we had elastic capacity in terms of the providers. I mentioned about integration and cooperation. I said our supply chain, before we were calling it, if you're told to draw our supply chain system, it was a spaghetti. We used to draw a spaghetti diagram because there are many stakeholders, many distributors, but now we're integrating into one supply chain system. Reason being because we have the capacity, because we are now working with the private sector. What else do I need to mention? The opportunities ahead. The opportunities ahead is we need to do a lot of data sharing and interoperability of our different systems, both at the national level with the development partners, the MOH strategic programs, and also the distributors, so that everybody is able to see in the pipeline what is supposed to be going out and at what point. The other thing that needs to be strengthened is public-private collaboration. Over and above just contracting the distributors and saying, okay, I've contracted you, carry on with the distribution, is to treat these as a collaboration, as a partnership, where the success of the vendor is also our success. The other one is capacity building, frequent capacity building. Like for instance, in handling of cold chain, some of these transporters need a little bit of some capacity building on how to ensure they manage this. And then of course, we all of us have been talking about green logistics. So we need to work with the private sector and ensure how best can we embrace green logistics. We have been working with Coca-Cola. I'm sure Angela is aware about that collaboration with Coca-Cola, to see how best we can embrace green logistics, just like they have in Kenya. And of course, what other opportunities are there to ensure that we embrace green logistics? The other one, of course, is to ensure that despite the fact that we have policy and regulatory frameworks, we need to review them to ensure that they are responding to emerging distribution and logistic issues. Innovation and technology, we need to embrace innovation and technology. At the moment, we have embraced e-locks. All our vehicles have e-locks to the extent that anytime the vehicle is opened, we are able to see from our warehouse that the vehicle has been opened. And if it has been opened at the wrong place, we'll be able to ask a question, why have you opened the vehicle? The other thing to do with technology, we have ring-fenced the routes, the various routes that vehicles are supposed to be traveling. So if you travel outside the route, then of course, we should be able to ask you questions. And it's somebody who does that 100%. The other thing that we have embraced is EPODs, though it's not 100% implemented, but we do have EPODs. And the reason as to why it has not been implemented is because there's a requirement of sign-off for the physical POD, the proof of delivery. But we are working around to see how best we can work towards that. Then, of course, in terms of crisis preparedness and response coordination, of course, we need to work with the key stakeholders, the distributors, and our development partners, and definitely MOH, and to see how best we can respond to crisis preparedness, because crisis will always come up. So, and of course, there are opportunities for supply chain strengthening, like what VillageReach is doing, working with KEMSA, that is supply chain strengthening, is an opportunity for us to embrace the like-minded organization like VillageReach, among others, to ensure that we do get the expertise that we need. If I may jump straight away to the last aspect of the question, of course, M&D, it is an opportunity to strengthen M&D, monitoring, evaluation, and learning, picking new learnings and trying to improve the best we can. So the last question was on what are the key opportunities for strengthening these partnerships to ensure more efficient and sustainable. I think I've mentioned about strengthening data-driven decision-making that I've mentioned, where we need improved information system, data analytics, very important, embracing AI as well, performance measurement, we need that as well. And then, of course, there is optimizing the resources allocated, ensuring green logistics are embraced, waste management is a must, and of course, circular economy, we need to embrace that. Is there anything that we...
I think you did a very good job. Thank you so much for bringing us this point of view reflection on how Kenya approached, especially the partnership we have strengthened in both distribution and cold chain planning. I really like and appreciate when you say the supplier felt and we also felt. That is really an honest reflection of insight in the importance of accountability. I have a question for you, but it's just a quick one. You've already mentioned a lot of it, but there is a question in the chat. Someone has asked, so I'm going to pass this question to you. What are the long-term strategies that supply chain companies and policymakers adopt in order to balance security, cost-efficient, and uninterrupted flow of trade? This question is coming from Spamandla Zungu. So could you please give us your thoughts on that? I'm not sure if you want me to repeat the question.
Please do.
What are the long-term strategies the supply chain companies and policymakers adopt in order to balance security, cost-efficient, someone is calling me now, cost-efficient, and uninterrupted flow of trade?
Okay, I will endeavor to answer
that. Yeah, wait, but
very fast. Thank you. Thank you very much for that question. As I mentioned, is the fact that what we normally do, we work closely with our 3PL providers to ensure that, number one, commodity security is never compromised, ensuring that the turnaround time is effective. But at our level, of course, as I said, it's demand driven. So we'll ensure the availability of the products, respond to customers' demands, work with the 3PL providers to ensure that delivery is done, to ensure that commodity security is done. But on cost efficiency, the best thing that we are doing is to ensure that we are integrating program commodities vis-a-vis the usual essential medicine and medical supplies. Before, the program commodities were moving differently from the other essential medicine and medical supplies. So now we have done horizontal and vertical integration. So I would mention that. Thank you.
Thank you, Eliud. So now let's move to Mozambique. Let's hear from Antonio. Is one of the professionals really playing and work closely with Mozambique. So Antonio, question for you is, Mozambique started its transport reform about 10 years ago or more, and Project Lastma has been key player supporting CIMAM. So from your view, what are the main lessons from that journey, and what should be the priority now to make transport stronger and avoid disruption, and how do you see the private sector fitting into Mozambique health supply chain in future? And Antonio, we have 5 minutes. We really need to be on time this time so that we can give opportunity for our audience to ask questions. Go ahead.
Well, thank you, Angelina. Thank you for inviting me on behalf of the PLM to share the experience that we have in Mozambique. Over the past years, Mozambique have started this reform on the transport sector, trying to make the commodities and the services being available in the country. It involved the investment on the main corridors that we have in country, because without those corridors, you cannot have your commodities being shipped from one point to another point. So we invested in the southern corridor, also the Central Corridor, and lastly, the Northern Corridor. This has increased the capacity to move the commodities from one point to another one. And also, if we are talking about availability of the health commodities at the health facility levels, it also helped on increasing the roads to make those commodities available at the lower level. But even with all that investments, we still have some challenges that we faced in Mozambique, not only on the perspective of logistics, but mainly in terms of those provinces that are really critical in some points. As the government is investing on building some infrastructure, also to allow the decentralization of products and commodities, we still face some challenges in some provinces such as Nampula, Zambia, and Tete, where, as you know, Mozambique is a very vulnerable to cyclones and heavy rains, which may affect part of those infrastructures. We are talking about bridges, some roads that may not facilitate accessibility to other points. So the investment should also be in terms of building more robust infrastructures that we need to invest in order to avoid these disruptions across the supply chain. Of course, that we have been supporting the SMAM in terms of that. And the other thing, one of the takeouts that we take from there, from this journey that we have, is in terms of the policy and the regulatory modernization. The introduction of the performance-based contracts and the public and the private sector partnership models that have been an important shift through regulatory enforcement, but it remains a challenge, particularly when we're talking about the quality and also the safety standards. The other thing is that one of the things that we've learned is in terms of the organizational and institutional learning. The government, alongside with the development or implementing partners, has gained a valuable experience in designing and managing transport projects. We have learned some lessons, including importance of maintenance of funding, not just capital investment that need for better coordination and across ministries, and the risk of relying too heavily on donor-driving projects without long-term sustainability plans. This has been an issue, and Mozambique has recently faced a huge challenge with the stop order from the USAID, and immediately we had to start thinking about on how can we overcome these challenges in a short term, which is not possible because everything relies on investment and also on the government budget to support that.
Thank you, Antonio. Thank you. Hello?
Yes, I can hear it.
Okay, are you still talking?
Yes, I was just trying to finalize in terms of what are the current priorities for strengthening its transport system. Of course, the main challenge in Mozambique still the last mile connectivity and also the rural areas. I have touched the base that in some communities in Zambia, Nampula, and Cabo Delgado, most recently, have some disruptions, not only in terms of the roads, the bridges, and also with this critical situation that we are facing now in Cabo Delgado. So integration with the ICT, which is information and communication technology. I believe that this has been mentioned by the Kenyan representative. And so these are some of the current priorities that we are trying to target in Mozambique so that we can be able to manage the transport and also to manage sustainability, ensuring sustainability for Mozambique. And in terms of the roles, yes, I just want to take 1 minute to talk about the roles of the private sector for the future health chain.
Yes, 1 minute.
Yes, we need more competitive private sector, particularly in terms of the 3PLs, to fill the gap that the government cannot fill at the lower level. We are talking about the last mile distribution, which is the government has not the clear idea on how that can be done. So the private sector can play a very important role into that. And also building resilience through partnership with the private sector, because we need to start introducing innovations on the distribution, and also to teach the government on how this process can be managed, and also investment on skill transfer, because the government needs to take the ownership on the transportation and the distribution, and also with the partnership with the private sector.
Okay, thank you so much, Antonio. I know we are running out of time. We still have one guest. I have a question for you, but I'll come back to that, Antonio. So let's move to Zambia, where we are going to hear from the private sector perspective. Mr. Prince Dube, what are the key challenge companies face in attracting opportunities and engaging with government in public health sector? And in your view, what steps could the government take to build stronger and more sustainable partnership with private sector players? And you have also 5 minutes. Thank you.
Thank you, Angelina. Thank you very much for the opportunity to contribute to this very, very important discussion. I mean, from the private perspective of the private sector, have noted a number of systemic and operational challenges that affect deeper and productive engagement with the government in Zambia's health supply chain. I think in the introduction that you sent in this webinar, you discussed my role, and I would like to point out that we have been in this space for almost 10 years now, and the challenges kind of remain the same. There are certain interventions that the government has taken, but we realize that the more things change, the more they remain the same. So some of the key challenges, I mean, there are plenty, trust me, but because of time, I'll focus on the maybe top 3, 4 challenges that we have come across. And these are real life practical issues that we've encountered. So the first one, top of my mind, because, you know, in private sector, we obviously we subscribe to certain values, and we have certain missions and visions, but we are a for-profit organization. And one of the issues at the top is that procurement processes, public procurement processes, tend to be very complex, and there are a lot of transparency gaps that we have seen. I mean, in Zambia, for example, they transitioned from procurement of commodities from the Ministry of Health to the Central Medical Stores, which is called ZAMSA here. But still, the processes remain very slow, very bureaucratic, and oftentimes there's lack of transparency. And what, of course, there have been some positives, especially in terms of publishing of opportunities. We realize that there's been a push to go digital, and most opportunities come via the e-government procurement portal. But even with that, the evaluation criteria still remains very hazy and unclear. And at the end of the day, there is really no explanation, especially to losing bidders. There's really no explanation to say what exactly did you do wrong, what exactly did you miss, and where can you improve? Because I believe that if government really wants to encourage participation by capable local companies, they should go to a mode where they try to help these local companies and build capacity in them. Then related to procurement, obviously, if you get the opportunity, like we have thankfully been getting opportunities, but you come across issues of delayed payments, and that's a very big issue for most companies because it affects the financial health and erodes confidence of service providers when payments are delayed. We have come across situations where we've had delays almost going into over 2 quarters, almost into 3 quarters. And you know, in these spaces, in places like Zambia, we hedge against the dollar. So when payments are delayed, we also then struggle with meeting the cost of sales and other obligations to our manufacturers or suppliers. So we have also noticed that there is limited access to strategic planning data to the private sector. Most of the times we see quantification tools, quantification reports when they have already been published, and we rarely get that opportunity to interact at the beginning of that process, which is something that I believe if it is implemented proactively, it could help to plug some of the gaps that then take place during the post-quantification engagement. What could government do? Some of the recommendations that we have had to government.
Please have 1 minute, I'm sorry. You have 1 minute your time. Yes.
Thank you for the reminder. All right, so issue of payments, I think government really needs to commit to timely payments to help private sector organizations to be effective in delivering on their contracts. Then I think, like I said, government needs to look at building capacity through providing technical support to grow participation of compliant local private sector companies. I think I've stopped there. Thank you very much.
Thank you very much, Prince. That is a very, very reflection. I've got so many questions for you, but because of time, I'm going back to Antonio. There is a question on the chat, and I want to read it to you because we don't have Mozambique government with us here. So from implementing partner working close with the Minister of Health, do you see the government of Mozambique adapting to the recent USAID fund cuts for the health product distribution? What measures are being prioritized to maintain continuity and strengthen the system despite this challenge? This question is from Olivia Bryan. So we don't have anyone from CIMAM, but I know that you are with CIMAM almost every day, and we have insight that most of us don't have. So do you mind if you can give us some insight on how our government is responding to the EXPO order?
Well, thank you, Angelina. Thank you, Olivia. I'll try to be as short as possible. I know we are running out of time. So what happened with this situation is that the central medical stores and also the Minister of Health, they started to engage with the implementing partners. And at least we still have the Chigar project managing the last mile distribution of health commodities across the country. And also in terms of the data visibility, based on that engagement with the implementing partners, we now have the VillageReach supporting the hosting of NSMAM data at Amazon until October 2026. So now we are trying to prioritize other areas that we need to maintain the SMAM's infrastructure and also the supply chain continue moving forward until the next orders that we will receive. But the Project Last Mile is also supporting on the software licenses and maintaining the infrastructure at SMAM level. So these are some of the priorities that have been taken, and we're still looking into another implementing partners to support us as well. Thank you.
Thank you so much, Antonio. And please share more questions. We can follow up questions. And I'm going to come 1 minute to you, Odit. There's a question for you also. I think it's from, let me see here, it's from, I'll read the name, and the question is say, for your clear and insightful clarification, thank you. And what are your recommendations for implementing effective collaborating risk management in outsourced operation? And the question is coming from Mehari. I hope I pronounced it well. Judith, that question for you.
Thank you, Angelina. Yeah, it's a good question. I won't take the whole minute. So the main thing is to focus on the partnership from the get-go. Both partners should work very closely and share responsibility. During the contract period, they clearly should outline who handles what during this kind of, whenever there are risks, whenever there are disruptions, and both sides should take responsibilities, and they should be able to have a shared dashboard to track deliveries, to see the road conditions, the weather, the security conditions. All this should be displayed in a dashboard where there is available digital tools. And the other one is, running joint emergency drills would help, for sure, would help prepare for unexpected events. And there has to be also some sort of, co-investing in backup hubs whenever there is some sort of risks. There has to risks on the way to deliveries. There has to be some hubs that the drivers or the deliverers or the transporter should be able to put those sensitive commodities to there. So the well planning ahead of time and having a clear responsibilities and shared responsibilities from the get-go should be able the way to effectively manage risks in this condition.
Thank you for everybody. Thank you so much, the speakers, for sharing your valuable insight into our audience, for your active engagement. So today we heard about how public-private collaboration, learning from the past experience, and integrating transport warehouse in digital systems, mutual trust and contract essential to build stronger and more resilient health supply chain. We have seen how innovation and data can drive smarter decisions, for example, in Kenya. So on behalf of VillageReach, special to advocacy team, Jocelyn, she's somewhere there on the screen, and SAPICS, special thanks to Claire and Kano for their dedicated supporting organizing this webinar, and to our speakers for their valuable contribution. I want to say thanks our audience for joining and being with us today. So let's keep this conversation alive and continue working together to ensure health products reach every community in need. For any follow-up questions, please feel free to reach to our speakers on the email Claire is going to share on the chat, and you can also reach out to me through email shared in the chat. So thank you, and God bless you.
Thank you, Angelina. Thank you, everybody.
Thank you. Bye-bye.
Thank you. Bye.